We have also been able to introduce the proper sharing of medical records, like I said, through vertical and horizontal programs in partnership with Farm Access. We are doing that project in Kilimanjaro. We are introducing the interoperability of medical records whenever a patient moves from one facility to another.
If I would picture a map here on the stage of how healthcare financing streams flow through East Africa, it would look like a bowl of spaghetti. There's government money, there's Linda Mama, there is Gates Foundation money, there's USAID money, there's PEPFAR, and it's all doing a lot of good. But each financing stream comes with its own inefficiency and ineffectiveness. And digitalization allows you to target this funding in a health wallet at the level of the patient, rather than into all these different institutes that each come with its own administrative cost.
By 2025, that's next year, the compound annual growth rate of data for healthcare will reach 36%. So we can all agree that healthcare is producing data more than any other sector.
In Tanzania, we do have a Personal Data Protection Commission, and this commission is responsible for data protection under the Act 11 of 2022.
Whatever is being taken care of from one department, the records can easily be shared or seen by the next caregiver in the next department. Now, the next challenge has been these particular records to be shared to the next facility.
Now, what we should be doing together is organize this data collectively as a data cooperative. The technology already exists that allows you to give consent what it's being used for, but also see that it is only used for that purposes.
These solutions are all developed using Tanzanian technicians, and therefore we are sure that the knowledge that was used to create this is being passed to within the government personnel, and therefore we are not bound to licenses or some proprietary aspects.
Here's a gold mine. We're going to lock it up, and if we don't use the right technology, the moment that data is only used once to train AI models of a company in the United States or a company of China or somebody else, that data is gone. The most important thing, you do need to protect it, but you need to register that ownership. And we've done that with a lot of other things. We've done that with music, we've done that with books, we've done that with pictures. It's not impossible in the world to protect things that are our intellectual property and not necessarily something that is tangible.
As many African countries don't have regulations around AI, but due to the absence of regulations in our country, I've seen some kids building AI tools and they go and sell them, which can cause harm. Like, try to imagine when an AI tool makes a mistake, who do you sue?
I saw this really nice, cool AI application the other day on pediatric oncology. Very rare disease. If you see 5 patients in Tanzania a year, you need to be connected through AI technology to other use cases to get your inspiration on how to treat these patients. It doesn't make you a bad doctor, it makes you a very smart doctor that you use these tools to search for information. And that is what we're advocating for. So let's start thinking about how we can unlock all of this value that this panel is talking about, making sure this protection is there, because that's going to be key. It's something that we barely understand. And I think the idea of giving every citizen in East Africa a data vault that is organized in a cooperative that manages the public goods, but that also manages the public and private partnerships that are needed to do this, I think we're going to end up in a very good place. And my money is on the fact that East Africa is going to figure it out first. And I'll be flying in with a KLM flight full of policy people from the Netherlands trying to learn from what you guys have done here.